Burning question.
Oh, yeah. Yes. So you didn't just attempt a constitutional coup there when you say that health is a shared function, because it is not a shared function. It is actually a devolved function. And Schedule 4 of the Constitution describes that clearly. So, and earlier on you said you really don't care so long as your workers benefit, whether it is constitutional, what the CS Health has done or not, cementing them as PNP, yet in actuality they are not in terms of remuneration. So this begs for the question then, is the problem the people we have? Because, even Olivia says the issue is resources, but if police are allocated enough resources for training, recruitment and deployment, the same can be based in terms of data and research and numbers, so that we're able to drive things constitutional. Is the issue the laws we have, that health is a devolved function, or is the problem the people we have in charge who choose and cherry pick when to suspend the constitution and when to apply it as they deem it fit?
I think the problem we have is prioritization of the
by the people.
Yes,
because the law is clear.
Yeah, the prioritization.
Mm-hmm.
And also in a bit the way we interpret the constitution and implement the systems, because law can be there, but how we implement and how we respond to the need is important. So I just believe we have not gotten structures in Kenya that work for us in terms of how it was devolved in the statement of the constitution, but vis-a-vis how it ought to be. So the proper channel that gives us the best service in healthcare has not been found, because you can't talk of service when the workers are always not paid.
They are on strike.
Yeah. So I think we just need to get the best structure. And where there is usually conflict, or where we see that we are not able to correctly interpret or implement the law, then it calls for people to come and say, we have an issue here, and maybe let's appoint a task force to do some inquiry and find out how best are we able to manage our health system. Because as it is, we can